Hello, I'm Navin, and I currently work as a clinical pharmacist at the Endocrine Institute Putrajaya Hospital, Malaysia. Today, I will be sharing some insights on how pharmacists can play their role as a member of a multidisciplinary diabetes care team. Diabetes is a chronic disease that poses a huge healthcare burden. Type 2 diabetes, which is the major form of diabetes, results from the insufficient secretion of insulin from the pancreas and increased resistance of the cells to insulin, leading to elevated glucose levels in the blood. Type 1 diabetes is an autoimmune disease characterized by the destruction of the beta cells of the pancreas that produce insulin, causing hyperglycemia. Patients with diabetes often show symptoms such as polyuria, polydipsia, polyphagia, blurring of vision, and drowsiness. According to the International Diabetes Federation, 537 million patients were living with diabetes worldwide in 2021, which accounts for 10.5% of the world population. The cost of managing diabetes is a staggering $966 billion, which is an 316% increase over the last 15 years. Attaining and maintaining good glycemic control is very important for diabetes patients. It delays the development and progression of diabetes-related complications such as myocardial infarction, chronic kidney disease, end-stage kidney failure, diabetic retinopathy, diabetic neuropathy, diabetic wounds, and limb amputations. These complications also cause a decline in patients' quality of life, which reduces their overall well-being. Medication adherence is the extent to which a patient's behavior corresponds with the prescribed medication dosing regime, including the time, dosing, and interval of medication intake. Studies have shown that with increased adherence to medications, the glycemic control improves. For chronic diseases like diabetes, a good medication adherence required is 80%, although in the real-world setting, it is only about 50%. Pharmacists, as experts in drug therapy, play a significant role in ensuring diabetes patients attain optimal medication adherence. One of the important services provided by pharmacists include medication counseling, in which they reinforce the correct medication taking instructions to patients. In addition, they may also assist patients who have difficulty remembering their medication instructions by educating them on the use of pill boxes and pictorial charts. Pharmacists also assess patients if they experience side effects due to insulin and oral glucose lowering drugs such as hypoglycemia and gastrointestinal side effects. Insulin injection techniques of patients, which is important to ensure the delivery of insulin into the blood, can also be assessed and corrected by pharmacists. Pharmacists can also review the patient's blood glucose levels and advise them on how to better manage their diabetes at home. They also educate patients on how to overcome fatal hypoglycemia episodes. Many factors affect the attainment of target glucose levels, including adherence to medications, diet control, and physical activity. Hence, the effective management of diabetes requires a multidisciplinary approach. This means doctors, pharmacists, dietitians, diabetes educator nurses, physiotherapists, and podiatrists work together for a common goal, which is to optimize the patient's glucose control. While the doctor diagnoses and prescribes medications, the pharmacist can deliver pharmaceutical care by counseling patients on medications and ensuring they have optimal medication adherence. They may discuss with the doctor on how to initiate drug therapy that is appropriate for the patient and also recommend that a particular drug be stopped if it causes side effects. Pharmacists may work with dietitians to discuss a patient's diet, which is affecting the response to drug therapy. The doctor may refer a diabetes patient with poor medication adherence, poor insulin injection technique, and increased frequency of side effects such as hypoglycemia for further counseling and management. This referral is done either physically through a referral letter or electronically in an electronic patient management system, detailing a brief history of the patient and the purpose of the referral. The pharmacist, after accepting the doctor's referral, performs the necessary assessments and conducts medication counseling. In diabetes care, one of the reasons patients on insulin therapy fail to reach glucose targets is the wrong insulin injection technique. Pharmacists need to assess the patient's insulin injection technique periodically, particularly in the early stage after insulin initiation, to ensure patients use the correct technique. In addition, the pharmacist performs a detailed medication history, which allows them to identify the patient's drug-related issues. The pharmacist then provides solutions to the drug-related issues. This includes increasing or decreasing insulin doses for those with unacceptable glucose levels, educating patients on the mechanism of drugs and insulin to improve medication knowledge, and educating them to manage hypoglycemia episodes should they occur at home, work, or while exercising. The pharmacist documents the summary of their assessments of the patients and the recommendations given as patient notes, which can be viewed by doctors and other healthcare professionals. In Malaysia, where I practice, there is a clinical pharmacy subspecialization for pharmacists in diabetes care. As a trained and certified provider of the Diabetes Medication Therapy Adherence Clinic, DMTAC, I practice in the diabetes clinic. DMTAC pharmacists like me work in collaboration with the treating doctor, dietitian, diabetes educator nurses, and physiotherapists. Pharmacists' DMTAC visit notes are readily accessible and viewed by doctors and other healthcare professionals. From these notes, the doctors take note of the recommendations by pharmacists. For example, in a patient who is experiencing nocturnal hypoglycemia, the pharmacist's recommendation to reduce the bedtime insulin is communicated to the doctor through these notes for further action. The doctor, after accepting the pharmacist's recommendation and reducing the patient's insulin dose, documents this in the patient's notes, which can be read by the pharmacist. This system allows for effective collaboration of pharmacists with doctors and other healthcare professionals. The Diabetes Medication Therapy Adherence Clinic DMTAC service was commenced in 2006 in hospitals and health clinics within the Ministry of Health, Malaysia. Currently, there are over 400 facilities with this service across Malaysia. Several studies conducted in different facilities as well as multi-center studies have reported significant improvement in medication adherence levels of diabetes patients who underwent the pharmacist's DMTAC visits versus standard care. These improvements have translated into improved glycemic control with an average HbA1c reduction of 1.7% in a 9 to 12-month duration. This is more than 1% HbA1c reduction that was associated with reductions in microvascular complications such as diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy, as well as macrovascular complications such as myocardial infarction and stroke, shown in the United Kingdom Prospective Diabetes Study, UKPDS. Healthcare and digital technologies cannot be separated in the current era. There are more efficient ways in which the interprofessional collaborations can be carried out. This includes the utilization of mobile applications in which multiple healthcare professionals, including doctors, pharmacists, dietitians, and diabetes care nurses, can view each other's patient notes and communicate in real time. More importantly, they are also able to engage with the patient in real time to ensure any interventions are communicated to the patient almost instantly. The interprofessional collaborative practice in diabetes care has proven beneficial in improving treatment outcomes. Pharmacists play a vital role in ensuring optimal diabetes treatment outcomes by working in collaboration with doctors and other healthcare professionals. The collaboration can be further strengthened by improving interprofessional referrals and having multidisciplinary discussions on patient cases. Thank you.